Now back to the show. This is The Law Show on CL 650.
Glad to have you with us on this episode of The Law Show. Our guests are Joe Murphy, QC, and Angela Price-Stevens, both with Murphy Batista, LLP, personal injury lawyers in downtown Vancouver at 650 West Georgia Street and online at murphybatista.com. Promised that when we came back from the break, you two, we would spend some time on the process. If someone listening to the program today is either personally involved in an accident, whether it's a sporting event, you fall down skiing, you take a shot to the head playing hockey, you're in a beer league, or you're in a traffic accident, and you suspect that there's a concussion, there's a brain injury, if you suspect there's some kind of traumatic outcome, what do you do? How do you begin the process of, first of all, finding out whether you're right, and secondly, seeking redress for what has happened to you? Joe, you want to start us off?
Well, Sterling, the effects of the brain injury are almost identical to the effects of pain and are almost identical to the effects of depression. So in the early stages, what I do with people is just simply say, we want to help you, guide you through this rehab recovery process, that if you have a concussion, the chances are 90% that you're going to fully recover. Mm-hmm. You don't want to scare people into thinking that their life is over, because most people do recover from that concussion or mild brain injury in the sense that their life goes back to normal.
Right.
But there's always the difficulty of teasing things out between what's from the pain and what's from the depression that usually comes when people's lives are changed, and from a concussion. So it takes time for the dust to settle,
right,
and for you to be able to see that. One of the interesting things is I've acted for a lot of people who've suffered spinal cord injuries. And when you have a spinal cord injury, of course, from the moment the ambulance arrives, there's this huge focus over this, usually a neck fracture. Mm-hmm. And I found that in a third of the cases I've done, once that person gets into a rehab setting, it's discovered that they've had a concussion. And the usual scenario is the physiotherapist, and in this case a GF Strong, will say, this is really funny, he's a bright kid, but he keeps on forgetting the instructions I give him about what he's supposed to be doing in therapy.
Right.
And that's when they twig into the fact that you have a brain injury in a third of the cases where there's been enough violence to cause a back fracture.
Angela, in terms of identifying the brain injury, do we have, and I think I'm using an American term, so forgive me if I am, but do we have a statute of limitations in Canada that says if you're going to sue somebody for an injury that you've sustained, it has to happen within X amount of time? Or is a brain injury category kind of an open and different ballgame altogether?
No, the statute of limitation applies. It's 2 years generally, speaking from the date of injury, or 2 years from the date of knowledge, which is normally the same date.
Okay.
Unless, of course, you're a minor, and then it's going to be 2 years from the date of reaching the age of majority, which in BC is 19. And there's only one other exception to that, and that is the limitation doesn't begin to run for an individual who is under a disability. However, the disability has to be quite significant. It has to be significantly more than you were unwell, or you had some injuries that kept you in hospital for quite some time.
Right.
So generally speaking, it's the 2 year.
Okay.
As normal.
So is it likely that if there has been a brain injury, that 2 year time period would be plenty of time to identify it, the nature of the injury, and begin the process of rehabbing from it?
I could never agree with the adjective plenty. I personally think 2 years is too little. I've come from a jurisdiction where it's 3 years, and I think 3 years is a more reasonable time period. So I do not agree that 2 years is plenty. However, there would normally be signs and symptoms of potentially sustaining a brain injury. As Joe has said, these can be confused with other conditions, but at the end of the day, if you've suffered an injury, my golden rule is you must always go and seek advice from a lawyer at an early juncture, and that way the 2-year limitation will not be an issue.
Right.
The 2-year limitation only becomes a stake in the heart where somebody has either usually the situation is this: you have somebody who's been injured, and they think, I'll be fine, I'm getting over this, I'm getting better, I don't need a lawyer, I don't want a lawyer, I'm recovering. And then they leave it, and the time lapses, and by the time they come to us, it's either the 11th hour or it's midnight.
Or the past, right.
It's midnight, and they've already turned back into a pumpkin. So so it comes back to always getting seeking that consultation early on.
And Joe, that's what we're talking about in this segment of the program. What to do when something like this happens in your life or to someone close to you. The recommendation from Angela, of course, is seek some advice. Find out what's going on, where you stand. I know from previous conversations you and I have had that to arrange such a meeting with you or one of your colleagues at Murphy Battista is free, and you're likely to get a reasonable amount of time to present the facts to a sympathetic ear. How soon should you get at this? As quickly as possible? Is that the idea?
The answer is yes, but, and the but is the person with the brain injury doesn't recognize that there's anything wrong.
Yeah.
So if someone injures their knee in an accident, they know better than anyone else what's wrong with their knee. They know when it gets sore and when it gets swollen.
True.
But with a brain injury, they know less than anyone else that something's happened and things have changed. So it creates this awkward situation where we have this 2-year rule for starting a lawsuit.
Right.
But the person who has the claim thinks they're okay. So it's a dilemma, and it really comes down to the family or the friend or one of the treating people to say, you should go and get some advice. And we always want to meet with the person who's been injured and someone who knows them well.
Right.
Because the information that's really useful comes from the person who knows them well.
And that's why I'm phrasing the questions, Angela, this morning in the form of, if someone in your life has been involved in some kind of traumatic event that you are suspicious may not have, and it's not going to end well. It was pretty nasty. So if you're that person in the injured person's life, you might have to step up and at least help that person arrange that all-important, that critical first meeting with a lawyer.
Absolutely, and not just arrange it, but go with them.
Yes, yeah.
Because it's one of the many complaints that these clients have is forgetfulness, just plain old forgetfulness.
Sure.
And so making an appointment, they may not turn up. So make the appointment, bring them along, and just have that free consultation and see if something can be done.
And Joe, if and you've already pointed this out a couple of times, there may be an exchange of information that's important for that second person to provide to you and your colleagues that maybe in that first meeting isn't the appropriate spot for this information to come out. But then that's where it all gets started, right? That's where you can say, listen, send me an email on that, or give me a call, and we'll discuss this at further tomorrow or whatever. It all starts, though, as a result of that first meeting.
It's got to start with that. The most common scenario is not the person phoning saying, I want to come and meet with you about this accident I was in, but it's the friend or relative that phones. One of the effects of a brain injury, ongoing effects of a brain injury, is a real difficulty in making decisions. So the other problem you have is a person comes in, they're not sure if there's anything really wrong with them, but they're really struggling to make any kind of decision, and they shy away from it. So you've got the memory problems that Angela mentioned, and you've got this struggle to make decisions. So it really needs a friend or a relative who sort of takes charge of it and says, listen, we need to do something about this. Otherwise, the brain injured person is likely to leave it, and the 2 years runs and the time closes to make a claim for something that turns out to be devastating to their life.
All right, we'll continue this conversation. We need to take a quick break here. Our guests, Joe Murphy, QC, Angela Price-Stevens from Murphy Battista, personal injury lawyers here in Vancouver. We're talking brain injuries and concussions, with more still to come after this quick timeout.
There's more of the show still ahead. This is The Law Show on CL 650.